Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with Dr. Vasken Artinian about sleep disorders. Okay, Dr. Artinian, I'm really interested in insomnia because that has to impact so many people.
Absolutely.
What is it?
Well, insomnia is a sleep disorder. It's mainly characterized by difficulties in initiating and maintaining sleep. In other words, an individual who suffers from insomnia will have only limited hours of sleep at night. And as a result of that, the individual experiences a lot of tiredness and fatigue and impairment in quality of life in general because of insomnia.
Does everybody have insomnia sporadically, or if you're having trouble at work or something's going on?
Good question. We classify insomnia under two major categories. We have an acute insomnia and a chronic insomnia. Just like you said, Barb, the acute insomnias are the ones that are triggered or precipitated by a certain event. And it can be a loss of a friend or a family member. It can be other social stressors like divorce, financial trouble, Usually there's a trigger that precipitates an acute insomnia. And most of the time, once that trigger or the precipitating factor is eliminated, the insomnia would improve. Whereas in chronic insomnia, these are conditions that are more chronic. They are related usually with chronic medical problems such as anxiety, generalized anxiety disorder, and depression. Not to forget, substance abuse and alcoholism can also cause chronic insomnia. So these are the ones that are more difficult to treat compared to the acute insomnia.
Is it important to diagnose and treat chronic insomnia?
Well, absolutely, because just like as I said, they have a lot of implications on your quality of life, and it can cause a lot of long-term, they can have long-term consequences on health in general, including chronic medical problems.
So how do you make that diagnosis?
In general, it's by history taking. We don't have a specific diagnostic test that would diagnose insomnia. What I found useful in the sleep center is to obtain sleep logs on patients that can accurately describe their sleep habits and their patterns of sleep, and it can really tease out how many hours of sleep that they're having each night and what are the factors that are really affecting their sleep in general. But usually, more than 95% of the time, we can make the diagnosis of insomnia just by listening to the patient and obtaining clinical history. Now, in certain few instances, we have done sleep studies on these patients, and the sleep study is basically to rule out other sleep disorders that can potentially coexist with insomnia.
How do you treat insomnia?
Well, this is the treatment is a little bit difficult. We combine both pharmacological treatments and non-pharmacological treatments. In my experience, by combining both, I've seen good success. By non-pharmacologic treatment, I mean essentially behavioral treatments, such as things like improving the sleep hygiene, stimulus control, relaxation techniques, and cognitive behavioral therapies in general. Whereas pharmacologic treatments are use of medications such as hypnotics. And we have a large number of hypnotic agents that we can use in insomnia. And the choice of the medication will essentially depend on the patient, his age, his side effect profile, and the clinical history.
And so, actually, would these treatments work on either type of insomnia, short-term or long-term?
It's more beneficial in chronic insomnias.
Okay.
In acute insomnias, the treatment will be basically eliminating the trigger or the precipitating factor.
Yeah, getting over whatever happened.
Getting over of what caused it originally.
Let's talk about parasomnias. What are they?
Well, parasomnias are, again, sleep disorders. We classify parasomnias into two different categories. The first category is the parasomnias that occur during non-REM sleep, and there's another category of parasomnias that occur during REM sleep. Now, the parasomnias that occur in non-REM sleep are usually the ones that we see in younger people, in pediatric population, and these are the ones that are commonly known as, confusional arousals, night terror, sleepwalking, sleep talking, you know, that type of activities at night. Whereas REM-related parasomnias are more in the older population, and the most commonly known parasomnia is REM behavioral disorder, and this disorder we usually see it after the age of 60.
Can these be treated?
Usually parasomnias are benign. You know, the parasomnias that occur in pediatric population, the non-REM related parasomnias, are the ones that are very benign, that they're self-limiting. I usually tell the parents, you know, to make the sleep environment quite safe, so that the individual who is experiencing the parasomnia would not injure himself, such as during a sleepwalking episode, let's say. I also tell the families not to awaken the individual who is experiencing a parasomnia, because that sometimes can cause a paradoxic agitation. But I would tell the majority of these cases are benign and they don't need any treatment unless they become of any significant concern. Now, in terms of the REM-related parasomnias, such as REM behavioral disorders, these sometimes can be violent and they may warrant treatment. I would treat these conditions only if they become more violent and more aggressive behavior would evolve during sleep.
You've given us lots of great information about sleep today. Do you have any closing comments?
Well, I would like to thank you first for having me, and thank you for shedding light on such an important topic, which is, in my opinion, is relatively under-recognized in our communities. We're going to be working with McLaren Port Huron Sleep Center, improving patients' sleep quality, and hopefully we can improve their quality of life in general. Thank you for having me.
Thank you for joining us.
All right.
And thank you for joining us. We've given you a lot of information about sleep today. And if you have any questions about anything we've talked about, call us at Health Access. That's 1-800-228-1484. You know, you can always go to our website. That's mclaren.org/PHTH and get lots of great information, watch any segment of this program. As always, we hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, a leader in healing and your partner in health.